Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Katsina opens new isolation centre as state government battles to prevent rise in caseload. And South Africa to get 2 million doses of COVID-19 vaccines from Johnson & Johnson by month end. According to the Nigeria Center for Disease Control (NCDC), the following states, Cross River, Oyo, Ogun, Taraba, Sokoto and Kogi states have 0 cases on admission. All the other states account for the 1,495 cases currently on admission. So far, over 2.2 million samples have been tested in Nigeria till date. This is as about 561 cases have been recorded in the country between the 2nd and 15th of June. Let's take a look at the report.
The Nigeria Center for Disease Control has continued to offer advice on the measures to be taken to prevent the spread of the virus, including maintaining physical distance from others in public settings. According to the agency, the number of COVID-19 daily infections have declined significantly as 17 cases have now been reported from 3 states in the last 24 hours. Lagos State led the chart with 13 cases, while Rivers and Gombe State reported 3 and 1 cases respectively. The agency also reported 0 cases from the Plateau, Nasarawa, Cross River, Imo, Kano, Bauchi, Kaduna, Sokoto, Oyo, Ondo, and Ekiti State. The latest tally has increased the number of confirmed cases in Nigeria to 167,095. 14 people have also been discharged after testing negative, raising the number of recoveries to 163,483. There were no new deaths from COVID-19 complications, leaving the fatality toll at 2,117. The latest update by the National Primary Healthcare Development Agency shows that over 1.9 million eligible Nigerians have been vaccinated with the first dose of the Oxford AstraZeneca vaccine, while more than 687,000 of those vaccinated with the first dose have now received their second dose. In the second phase of the exercise, Lagos State is taking the lead after vaccinating over 118,000 of its target population, followed by the FCT and Oyo State. In Africa, there are over 5 million confirmed cases of COVID-19 and more than 135,000 deaths on the continent. Globally, more than 176 million confirmed cases and over 3.8 million deaths have been reported from several countries.
Well, joining us right now is Dr. Abubakar Jafia. He's the Assistant Director, Surveillance and Epidemiology with the NCDC. He joins us via Zoom in Abuja. Thank you for joining us on the program.
Thank you so much for having me.
All right, Doctor, this week we've been recording very low case numbers. Last night, 17 cases. The day before that, 12. Monday, 7 cases. But the good thing is the death toll has remained the same. But we also noticed that some of the reports, the NCDC shows a list of states recording 0 cases for weeks and some even over a month. Can we say that, in those states, community transmission is non-existent and that there is or was adequate surveillance in those states?
Yeah, so first and foremost, I want us to be clear about what we refer to as the test positivity rate. This test positivity rate is an indicator that is used to understand the level of transmission of coronavirus. And this has been fairly around 1%. What it means is that, 1 out of every 100 people tested in Nigeria are positive for COVID-19. We are also, we know that there is a decline in the number of confirmed cases, and we are very fairly confident with our testing. Also, it is very important to really mention that there's still high incidence of COVID-19 cases globally. There's widespread prevalence of variants of concern And so this goes to remind us that the risks of the virus, still exist across the globe and Nigeria as well.
We'll come to the variants shortly, but I want to ask about if we can still say we are at that community transmission stage, or we can say that it's just one case or so that we're getting. Would you still say that with the cases we're recording each day, we are at that community transmission stage?
So the level of transmission has reduced slightly. Like I said, the test positivity rate is the indicator that will show us where we are. It has slightly gone down, but like I said, the risk is still there.
How does the NCDC verify the information coming from the subnationals on confirmed cases?
So really, one of our biggest priorities as NCDC in leading, the public health response to this pandemic is to try to provide and maintain accurate data about the rapidly, evolving situation. And we do this in close collaboration with all the states, that have this outbreak. So what we do is that upon diagnosis of cases in any of our accredited laboratories across the country, the data is shared by the laboratory to NCDC and of course the state ministries of health for verification before this is published. Also, I probably need to mention that NCDC has deployed an open source software referred to as SOMAS, which is Surveillance Outbreak Response Management and Analysis System, across all the 774 LGS in Nigeria. This enables us to have comprehensive reporting and analysis of COVID-19 cases, COVID-19, and of course other diseases in real time. So regardless of the challenges that we probably have here and there, we remain committed to ensuring transparency in reporting our data all the time.
Does this also apply to testing that is ongoing? Because, some states are testing between 20 and 30, while some others are not. We're not seeing the reports.
Yeah, so also, we have established laboratories across all the 36 states and the FCT. These laboratories remain open and they are functional. We have not run out of any reagents or supplies in this laboratory. Also, to enable increase in testing, NCDC and partners, are supporting the rollout of approved, antigen-based rapid diagnosis test kits, in hospitals and in some select closed settings to provide rapid point of care tests at rapid points of care. Notwithstanding that, we must not be complacent. There are still risks to Nigeria, especially with the poor adherence to the public health and social measures, and of course the emergence of the variants of concern also globally. So we want to appeal to all Nigerians to continue to adhere to the preventive, measures to get, your COVID vaccine if you are eligible, and if you have symptoms of COVID, please ensure you present yourself for testing. The responsibility to protect our country lies, with us, all of us, the government, and all the individuals, in the country.
Indeed, all of the measures working together, the NPIs, the testing, the contact tracing. But with what the NCDC set out from the beginning in terms of the sample testing target, would you say that you have met that? So
initially, the target we had was 1%, and NCDC has surpassed that 1% long time ago. So we are looking at, going further to give ourselves, another target, working with what the WHO has provided as a target for countries.
So let's talk about the variants. How much is the NCDC monitoring the different types that we have in the country at the moment?
So, concerted efforts are being made to increase, the Nigeria's genomic surveillance capacity. This is mainly focusing, on centers that already have existing genomic capacity. I want to mention here that as of today, a total of 838 sequences have been conducted in Nigeria. However, only about 134 variants of concern have been identified so far. These variants of concern that I'm referring to are really the B117 that is now referred to as the alpha variant. So irrespective of which variant we're talking about, the non-pharmaceutical interventions remain effective in controlling COVID-19 pandemic. So this means that we must all continue to take individual and collective responsibility to limit transmission of the virus, in Nigeria.
All right, we appreciate your time. Thank you so much, Dr. Abubakar Jafia, the Assistant Director Surveillance Epidemiology with the NCDC. Thank you for joining us at this time.
Thank you for having me.
All right, the federal government has restated its commitments through the Federal Ministry of Health. This is to provide more critical health infrastructures aimed at not only making healthcare affordable to all citizens in the country, but also to stop medical tourism. The Minister of State for Health, Dr. Olorinimbe Mamora, disclosed this during the commissioning and handing over of the NCDC Isolation and Treatment Center located at the Federal Medical Center, Katsina, represented by the Medical Director in charge of the FMC Gusau, Dr. Bello Mohammed. He says that the construction of the facility is part of government's intervention to curtail the spread of infectious diseases.
From 3 molecular labs in the entire country, we now have over 120 across the country, with over 70 in the public sector alone. Our ability to detect and to quickly respond has increased significantly, and this has been made possible by very close collaboration by state teams, federal government teams, the NCDC, our federal medical centers, our teaching hospitals across the country. We implemented a new surveillance system which your state team has really embraced, which has helped us to receive data from across the country in real time that has guided our response. I mention these achievements not to praise ourselves, but as a reminder of how far we have come. All in all, no doubt, the past year has been a challenging one. But being here, Your Excellency, today in Katsina, commissioning this new center at FMC, is a proof of the commitment, collaboration, and coordination of the teams behind this, from the leadership of the Federal Ministry of Health to the State Ministry of Health to the Katsina Federal Medical Center and our team at NCDC.
Resources provided by the state and other generous donations from the citizens were utilized to establish a 150-bed isolation center in the IDP camp, the 150-bed isolation center at the NYC camp, 2 wards in General Amadou Rimi Specialist Hospital, with a total bed capacity of 30, and another isolation center in the General Hospital Dora with 18-bed capacity. Drugs were also procured for managing COVID-19 cases. The state government collaborated with the Federal Medical Center in utilizing the Federal Medical Center Isolation Center for management of severe COVID-19 cases. We sincerely appreciate the role the Federal Medical Center Katsina played in this regard.
Still ahead, how important are antibody tests in the management of the coronavirus pandemic? Find out after this break. Welcome back. Antibody tests that can detect whether people have been exposed to new variants of COVID-19 have been developed by the University of Aberdeen. It's been described as one more tool to the toolbox of fighting the coronavirus pandemic. Professor Mirela Debigovic, academic lead on the project and a professor in diabetic medicine and dean for industrial engagement, University of Aberdeen, joins us now on the program. Thank you for joining us.
Thank you for the invitation.
All right. How accurate are these antibody tests, and how does it differ from what currently exists?
So yes, last year, in response to the pandemic, Scottish Government funded rapid research in COVID-19 projects, and ours was one of the projects to develop a novel and accurate antibody test. I should say at the moment our test is shown to be 98% accurate and 100% sensitive. This is a huge improvement on the currently available tests, and really it is incredibly important to understand the prevalence of natural infection in people who have had COVID-19. But also if we are going to go through the vaccination responses to see how well we are mounting antibodies against the infection. Also, obviously, it's incredibly important. I don't know if you've seen today's news as well in regards to recovery trial and Regeneron new monoclonal antibodies, whereby it has been shown that those individuals who are antibody negative, so they're most immune compromised, that is the therapy that works best. So it is important to have a really precise test in order to find those individuals that require the new therapy most.
So it's new, and what the test can do to circulating variants, virus or vaccine-induced immunity. How is the kit able to detect the virus or vaccine-induced immunity?
Yeah, so we have developed 4 different types of tests. So one of the tests can tell you whether you had a natural infection from COVID-19 as well as vaccination. So we can tell between the two. But what we've been able to do is use artificial intelligence software that we've been feeding information into from the laboratory, which could then detect for us the parts of the virus, so the SARS-CoV-2 virus that would be most immunogenic, therefore, produce the strongest response. So the company we've been working with, the biotech company Vertebrate Antibodies Limited, have been able to design a scaffold onto which they could attach 5 different parts of SARS-CoV-2 virus. And one of those parts or 2 of those parts could actually be the variant of interest. So now we can not only tell how well the vaccines are working or how well we have responded, recovered from a natural infection to COVID-19, but we can now also tell the variants that are predominant and whether the vaccines that people may have received are going to protect against those variants.
It sounds really remarkable. But then the other question is, how affordable will it be? As we know now, vaccines are not readily available around the world. And to aid global recovery from the pandemic, is it something that you're thinking about?
Yes, this was our number 1 priority. When we developed the test, when it started last year, this has taken about a year. Cost was one of the basic and most important things for us. We wanted this test to be suitable for mass deployment. So at the moment, it's actually in a 96-well format. So we could screen 96 individuals in one single plate. We have made sure that the tests are cheap and affordable. And this is really important because the technology we have used now for COVID-19, we are now hoping to deploy the same technology of artificial intelligence to actually look at other autoimmune diseases and make those tests cheaper and affordable worldwide, not just in a Western society.
All right, we'd like to thank you and congratulations once again on this game-changing technology as we look forward to the rollout. Thank you.
Thank you very much. Thank you.
All right. We've been speaking with Professor Mirella Debbie-Govich, the academic lead on the project, professor at the University of Aberdeen. To some more stories, President Cyril Ramaphosa has announced new restrictions as South Africa faces a 3rd wave of COVID-19. A nationwide curfew has been moved up to 2200 local time, while alcohol sales have been limited to Mondays to Thursdays. Now, public gatherings have also been limited to 50 people indoors and 100 people outdoors. Mr. Ramaphosa allayed fears over the slow progress of the country's vaccination program, saying 2 million Johnson & Johnson vaccines were expected by the end of this month. He added that South Africa had the capacity to vaccinate at least 150,000 people daily and urged those aged over 60 years to register to get the jab.
Johnson & Johnson is set to deliver 2 million COVID-19 vaccine doses to South Africa by the end of the month. As per Pharmacare, J&J's local producer had to get rid of 2 million doses of the vaccine after a contamination was discovered at a U.S. plant.
Massive surge in new infections means that we must once again tighten restrictions on the movement of persons and gathering.
New York's Governor Andrew Cuomo announced the lifting of most COVID-19 restrictions and celebrated the good news by lighting up the skyline with fireworks. Amidst the celebration, tough times are still ahead as New York City combats a historic rise in street homelessness during pandemic recovery. Most U.S. states have moved to ease or lift COVID-19 restrictions. And in the UK, British Prime Minister Boris Johnson rejects the opposition's assertion that delaying imposing travel restrictions aided the spread of more contagious Delta variant of COVID-19 across the UK.
Mr. Speaker, does the Prime Minister recognise that his decision to keep our borders open contributed to the spread of the Delta variant in this country?
No, Mr. Speaker, I think that Captain Hindsight needs to adjust his retrospectoscope because he's completely wrong.
In Moscow, authorities are making vaccination compulsory for public workers. A decree named a range of jobs from hairdressers, retailers, taxi drivers to bank tellers, teachers and performers. And finally, the French Prime Minister announces an end to the country's night curfew. As he says in his words, the health situation of our country is improving faster than we had hoped. The curfew will now end from June 20, as opposed to a previous June 30 target.
COVID-19 isn't malaria. Take responsibility to protect others. If you are experiencing symptoms associated with the virus, you can visit our website. It has more updates and stories around the pandemic. You can find other stories there as well, from politics, business, sports. It's all at your fingertips. It's on channelstv.com. Well, that's the program now. Thank you for watching. I'm Millicent Walker. Stay healthy.